Guys, so it's been 1 week since my surgery on my knee. So it's been a very tough week, physically and mentally. You may have thought I looked pretty good in that first video, being able to lift my leg up like that, but an hour later, that nerve block that I had from surgery wore off and I couldn't lift my leg anymore. At least for the time being. So that took a couple days to get back. But anyways, you can see my the outline of my stitches now, where they're at. As you can see, it's quite swollen compared to the other leg. But believe me, a couple days ago, it was a lot worse than this. Yep. Along with the nerve block wearing off and me not being able to lift my leg up, came a severe amount of pain just standing, not moving at all. And it took about 2 hours after I took my medications, my Percocets that I have. I took the 7.5 by 325, so that worked after 2 hours to get my pain level down, but I was in agony. These are pretty powerful pills here. They will work for you, but I don't like exactly how they make me feel. The 7.5 by 325 ones, Percocets, because they make you feel very nauseous, and during the day it's really rough to take those ones. But I'll talk more about that later in the video. Anyway, so yeah, I was in agony after that, but that wore away. And with the swelling going down and everything, I've had a setback as well, which sucked. But the blood would rush down my leg every time I would sit up. Like, I'd have terrible shin blood rushes, and it would be awful pain, hard to deal with. So I've been trying to get the swelling down, and I've kind of laid off the ice machine because of the risk of burning my skin, and although it provides constant cold to your leg, I prefer using the ice packs, small ice packs that I can put under this bandage here, which I use for my leg to compress it. The redness here, we don't know what it was caused by. It could have been from the ice machine, but otherwise it's just swelling coming down from the knee. As you can see, I have a blister here, and I'm getting sensation back. Originally, I did not have sensation here. And I do not have sensation in this one area on the side of my knee, which is because they sacrificed the nerve in the surgery, but that's nothing to worry about. That's normal. So anyways, so what I suggest for people who've had this surgery and are having these awful blood rushes down their shin bone is to get up frequently, not sit down for long periods of time without trying to get up and bear weight, or because I couldn't even bear weight after those started occurring. Went from being able to lift my leg and bear weight to not being able to do much at all with my leg for at least 2 days. So that was very rough, and that's one of the reasons why this is the hardest week. It's been tough mentally. You're like, oh, why this have to happen to me, and why am I going through this? It's so hard. I'm losing hope. But the important thing is that in the back of your mind, even though in the front of your mind, you might be like, oh my God, woe is me, and I'm losing hope. You gotta have that in your back. Have it in the back of your mind that I can get through this. It's possible. Other people have done it, and every setback is a setup for a comeback. So that's the way you've got to look at it. So anyways, I've had a setback on doing my exercises because of the pain I was feeling, but now I'm back to being able to do them. This will be my second time today doing reps of 10 leg lifts. So I'm going to do some right now. These are good. You want to make sure you flex your quad and lift your leg up. You can have your leg straight out, what makes it technically more difficult, or have it in. I'm just going to have it in for right now. So I'll start off like this, and then I'll do with the leg straight. All right, here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, that's that. Now I'm gonna go ahead and do some with the straight if I can. My leg straight. 1. I can't get as high obviously, but it's good to try. 2, 3, 4. Actually, I can get as high. Close. 4, 8, 9, 10. Alright, now I'm going to go into side lifts. These are good. Typically easier to do. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Another thing you can add for week 2 is you can have your leg under you and try to do some lifts like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, that one there is not something I suggest doing in the first week because you're going to have too much pain swelling, but I'm able to slightly start being able to do that. So now I'm going to do my leg extensions where I flex my quad muscle. As you can see here, it's much easier to see me doing it with my right leg, my uninjured leg. If you're looking at my right leg right now, you can see it doing it. My left leg, I'll do some with my left leg now. Sets of 10. It's going to be hard to notice anything really, unless you're looking at the upper part of my leg, but I'm going to start doing some. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright, so that's that. Now I'm going to scoot down my mat, and I'm going to do some flexions, where I bring my knee up a little bit. Now this is not something that is the most important thing in week 1. What you want to focus on most in week 1 is the extensions, because you want the graft from surgery, I had my patellar tendon done, to heal in the proper position. So this is not of most importance, but you can do it, I guess. I mean, the stitches haven't come out yet for me. They come out tomorrow, and they make it a lot harder to do this, but I can do it to a degree. 1, 2, and it makes it harder as well having my compression on there. 4, 5, 6, 7, 8, 9, 10. Now, other patients have said online it can take up to 3 months to get full mobility back in your knee, close to full mobility. But it's really not something I'm worried about right now. I'm more worried about the strength of the quad flexing and the extensions of my leg and keeping it straight. So those are the exercises. Again, I've still been taking my joint support pills and calcium pills and drinking cherry juice because it's meant to help with joint inflammation and juices, other juices. It's been hard to eat. It's been very tough. It's been, it's okay kind of because I'm not doing any sports right now, but like I said, week 1 is definitely very tough, and you can let it get the best of you, or you can just keep finding a way through and just keep moving. Don't let yourself sit down for too long, and just keep moving, because those blood rushes down your shin, if you get those from your surgery method you had, it's going to be worse if you don't move, and that can be excruciating, like 10 out of 10 pain for sure. But yes, I've been keeping my leg in the brace to help with all this, and keeping my leg straight. You can keep it elevated overnight, or as your swelling goes down, you may not need to keep it as elevated overnight. It's preference, but usually during the first few hours after surgery, first 2 days at least, you want to have that leg elevated above your heart as you're laying down. And I find that sitting up is also helpful as well for a long part of the day. Don't just be laying on your back the whole day, because that's going to cause the shin blood rushes to be even worse when you get up. But yeah, anyways, talking about the medicine, I've tried to go down to the 5x325 Tylenol and Percocet medicine because it takes the edge off for me now, but it doesn't cause all those other nasty side effects. With these, I definitely had to take the anti-nausea medicine as well, which kind of helped with that. But these smaller tablets. They're not as strong, and they just keep the edge off and keep me just feeling more normal, which is definitely good for your confidence in coming back from something like this. But definitely, it's a tough week. It's a very tough week mentally, but you just gotta find a way to get through it. And hopefully now I can keep moving on from this in a positive way.